here.
Well,
Okay.
Okay, so it looks like we have people beginning to come in now. We're going to wait until a little bit more people are in here, and then we'll get started. If I could ask everyone, all of the panelists, if when you're not speaking and you're not presenting, if you could turn off your video and also your audio. And then when I call for you, you can kind of step in, okay?
Sounds good.
Okay, so I am Mike McElhatton with the Borrego Desert Natural History Association in Borrego Springs, and I want to welcome everyone to tonight's program. This is part one of Desert Living, Desert Health. And I want to thank our panelists as well for taking the time tonight to be with us. Over the years, ABNA has presented a number of programs under this theme of desert living, architecture, energy, a number of different things like that. Now, tonight's program will focus on 4 areas of healthcare that are important to people in Borrego Springs, which is a desert community and a remote community as well. All of our panelists are speaking on areas of their expertise, and you can submit questions at any time, but we're going to take those questions at the end. Okay, so this is part one of a three-part program, and I'll say a little bit more about those other parts of the program towards the end of the program here tonight. Okay, so what I'm going to do is ask for each of the panelists to turn their video on and to introduce themselves and to very briefly say what their topic is going to be tonight. So I have Dr. Thomas on first.
Hello, everyone. My name is Dr. Thomas. Happy to be here. I am a family medicine resident at Riverside Community Hospital, and the topic that I'll be presenting today is desert allergies.
Okay. Dr. Sharare Gandhi?
Yes, good evening. I'm Dr. Gandhi. I'm a licensed clinical psychologist. I work at Borrego Health, providing mental health services to children, adolescents, adults across the lifespan. And I'll be speaking today about mental health and well-being.
Okay, Dr. Silas Jimai? I know we had some problems connecting here, so we'll see what, why don't we go ahead to Dr. Laura Getz. Oh, there he is. Okay, if you could introduce yourself.
Hi, everybody. I'm Dr. Jima here. I'm a family physician. I practice here at Desert Hot Springs with Borrego Health, and I will be sharing with you all about skin cancer tonight.
Okay. Dr. Laura Getz.
Hi, good evening, everyone. I'm Dr. Laura Getz. I'm a preventive medicine physician, and I am practicing at the Borrego Springs Clinic.
Okay, well, thank you all very much.
Oh, sorry, my topic is preventive medicine. So,
okay, thank you very much. So each one of you will have about 12 minutes to present your topic, and then we'll go on to the next person, and we'll take questions at the end. I'd ask people when you text in questions to identify the speaker that you're asking the question of, okay? And so our first presentation then is going to be by Dr. Thomas.
All right, perfect. Let me go ahead and share my screen. Are you all able to see the PowerPoint?
Yes.
Perfect. All right, sounds good. So, hi everyone. Like I said, I'm Dr. Thomas. I'm a family medicine resident at Riverside Community Hospital, currently in my first year. And today I will go ahead and discuss a brief overview of desert allergies. It's not meant to be a comprehensive overview, but instead just kind of shedding some light on some common allergies, particularly in desert climates. So to begin, what are allergies? Allergies is essentially your body's reaction to a normally harmless substance. Some of these substances include pollen, molds, animal dander, latex, Certain foods, particularly we're all familiar with peanuts, for example, causing allergies, and also insect stings as well. What are some symptoms of allergies? So symptoms can vary in multiple scenarios. They can be from mild to severe. If you think about mild symptoms, you think about more localized symptoms. These include rashes, hives, itchiness, runny nose, watery/red eyes, or sneezing. So very common, what we call allergic rhinitis symptoms, which I'm sure at least all of us have experienced at one point in our lives. Some other allergy symptoms more in the moderate category includes hives, itchiness, some swelling, some trouble breathing. So this signifies more of a spread to other areas of the body. And then worst case scenario, we have severe allergy symptoms, which are pretty rare, but can be life-threatening. And these affect the whole body. These include throat swelling, abdominal pain, some nausea/vomiting, some low blood pressure, maybe a weak and rapid pulse, and some subsequent dizziness as well. So how do allergies work? Why do we get allergies? So it all has to do with the immune response in our system. So this is just a very basic overview of how that happens. Essentially, when someone is prone to allergies, the first time you're exposed to a specific allergen, so let's say pollen, or for example, a peanut, your body will produce allergic antibodies. All of you, I'm sure, have heard about antibodies. There's different types of antibodies that fight certain types of infections. In this case, for allergies, we think about IgE, which is the antibody that you see here on the right side of the screen. The role of these antibodies are to find the allergens and help remove them from your body. And essentially, by doing this, subsequently, they release some of these cells that are called mast cells in your body, release a hormone called histamine. And when that happens, that's why we get the subsequent reactions that we do when we have allergies, such as the runny nose, the cough, the sneezing, etc. So how common are allergies? As I'm sure you all know, it's very common. There's more than 50 million Americans, so about like 1 in 6, that experience allergies from multiple different sources. I have a slide in the next couple of slides that actually describe just a bunch of different categories that we can be allergic to and different conditions, essentially. And the number of people with allergies is increasing every single day. So as mentioned, there's different forms of allergies. There's food allergies, there's skin allergies, allergies to dust, insect stings, pet allergies even, eye allergies, drug allergies, pollen, mold, latex, ragweed, which I'll discuss a little bit in a couple of slides, but it's a type of pollen essentially, and cockroaches as well. So as I mentioned, this will be a brief overview, and one of the ones I wanted to talk about is pollen, especially because this is very common, especially in the desert climates. So these allergies essentially cause allergic rhinitis, or as you all may have heard about them, is also called hay fever. So this is caused by inflammation and swelling of the lining of the nose and also tissues of the eyes. Very common symptoms with these: sneezing, congestion, itchy/watery eyes, nose, and mouth. A lot of these times, these are very seasonal. So they may occur more in the summer, they may occur more in the fall. It really does depend on when there's a lot more pollen in the climate, essentially in the environment. Treatment for these allergies include oral antihistamines. And I have a slide in the next slide that shows some common ones that I'm sure we've all seen in the store before. Some nasal antihistamines. So these will go instead in your nose instead of taking them orally. Nasal steroids as well. And a lot of times, to prevent these allergies, it's really recommended to try to avoid pollen by staying indoors when pollen levels are high in the environment. Recommended to close the windows so we can avoid this pollen going into our homes or into our workspaces. Also to use air conditioning as well, because again, if we open the windows to let some of the breeze come in, we can invite some of the pollen into our homes and workplaces. Also, if you've been outdoors for, let's say, a prolonged period of time and you've been working in the yard, and it's a day that's particularly heavy with pollen, it's very recommended you come inside, take a shower, change your clothes, That way you can prevent some of that pollen from spreading more into, your environment, your sofa, for example, or your hands, and then going into your nose, your eyes. So these are some common brands that I'm sure we've all seen in the pharmacy, any retail store like Target and Walmart. On the top left, you see Benadryl. That's an oral antihistamine that you can take. There's Claritin. A lot of my patients prefer Claritin because it's non-drowsy, and they can still take it in the morning, for example, go to work and not have issues with feeling tired or sleepy. Also, Zyrtec is another common oral antihistamine as well. In the middle here, you see Flonase. So Flonase is actually a nasal spray that goes into your nose, and that's a steroid spray. And actually the ideal medication to help with a lot of the allergic rhinitis are nasal corticosteroids, such as Flonase. Those are first line essentially for these type of reactions, but all these other ones would work as well. And then here on the right side, we have Afrin, which is also a nasal spray, but it's an antihistamine nasal spray versus a steroid nasal spray. So all of these are very common. There's multiple brands out there, both highly known brands and also more generic brands, but a lot of them are effective, and they can also help with reducing allergy symptoms. Now, I wanted to add this because I did find this on my search that I thought was very interesting. So the American Academy of Allergy, Asthma, and Immunology actually has a program where they're able to report pollen levels to people who are interested. And all you have to do is essentially sign up for this resource, and you get to your email information about what the pollen levels are like in your community. Are they high? Are they low? And this is very helpful, especially for someone who suffers from a lot of these allergies, because then you'll know, hey, maybe today I should close the windows, not really have them open, or I should even, now with COVID, we're all wearing masks, which actually also will help with a lot of these allergies. But just knowing like, okay, if the pollen levels are high, I might want to be a little bit more careful, maybe avoid outdoors if I can. And this is what you can find with that resource. They have a map, and every single marker that you see here is actually a station that's set up, and they're reporting levels and monitoring levels of pollen. This is another one too I came across, the Weather Channel. Very basic. You don't have to sign up, for anything. You don't have to put your email address if you want to avoid having these daily emails, for example. And in this case, you can, based on your location, you can see what the pollen levels are like. In this case, they talk about tree pollen, grass pollen, and ragweed pollen. And ragweed, not sure if you all have heard about this before, I'll talk about it in the next slide, is one of the ones that actually produces a lot of pollen and is very common for causing these allergic rhinitis symptoms. So the ragweed plant, like I talked about earlier, so it's a common source of pollen and a very common source of fall allergies. A single plant can produce up to 1 billion pollen grains, and these grains are very lightweight. So that means that they can float easily through the air. They can easily go in our noses, in our mouths, in our eyes, and they can be found in almost all states in the US. It's more common in the East Coast and the Midwest, but it's still, you can still see it here in the southwestern part of the US. Now, another allergy that I do want to talk about really quick is insects, particularly bees. So there's a lot of insects in the desert. The most common insect that lives in the desert is the bee. As we know, a bee sting can cause a normal reaction such as pain, swelling, redness around the sting site, but could also be pretty severe too for certain people who are prone to that. It can be life-threatening. You can have throat swelling, your blood pressure can go down, you can have a rapid, a low pulse. And the treatment for this is epinephrine, usually epinephrine shots, essentially. You would have like an epinephrine pen to help with preventing these life-threatening reactions. So lastly, just wanted to touch upon if someone does come in and they've been trying over-the-counter medications and it hasn't been helping, allergies, as much as for some people may not be a big bother, for other people it's pretty devastating. It can actually change their quality of life. It can prevent them from being able to go outdoors. It can ruin their day, essentially, just dealing with these allergies. So just one thing to note is that if you are trying all of these over-the-counter medications, you've been to your primary care physician and nothing is really working, you've tried some of these preventive strategies, there's a lot of allergy specialists that can help better control your allergy symptoms. There's other forms of treatment that they can give you. For example, something called allergy shots, which is immunotherapy. What this does is that it essentially exposes you over time to the allergen that you're allergic to. So for example, let's say pollen is just completely makes you feel really bad. You're at home, you can't go to work. They can expose you in small amounts of the pollen or of any allergen. So that way your body learns to tolerate that allergen versus immediately just reacting to these severe symptoms. In addition, you can always ask for an allergy test to identify allergens that are specific to your body. Usually it's a skin prick test. I'm sure probably at least some of us have had it in the past, where they'll test different types of substances on your arm or your back, and then they'll see what you're allergic to. So at least you have a better sense of what's triggering your allergy, because a lot of times patients may have multiple allergies, multiple allergens, and it's helpful to know which ones are causing the worst symptoms, for example. So these are my references, and I hope you all learned something from my presentation.
Okay, and thank you very much. And anybody again who has questions, they can text those in and we'll take them at the end. I think next up is going to be Dr. Gandhi.
Hello, I'm Dr. Gandhi. Again, I'm a licensed clinical psychologist, and I'll be speaking today on mental health and well-being. Due to technical difficulties, I do not have a PowerPoint, but I will be walking through just various topics as well and providing some information. So first, I'd like to start off by talking about what is mental health. Mental health is one aspect of our overall well-being. It really includes our emotional, psychological, social well-being. It affects the way that we think, we feel, the way we act. You know, it really includes both biological factors and environmental factors that affect, you know, our mental health. Biological factors being our genes, our hormones, our brain chemistry. You know, our brain is an organ and can produce chemicals that can be either too much or too little that affect the way that our mental health is. It can also be physical things such as health issues and thyroid issues that can also affect our hormones that cause symptoms of mental health like depression and anxiety. And then we also have environmental factors, which include our life experiences, such as like significant changes, stress, or even trauma that affects our mental health. So really our internal biological makeup and our external environmental factors work together to influence the way that we really experience the world and handle situations. Our mental health is important at every stage of life, from childhood to adolescence to adulthood, and is very common among all of them. Some signs that you or maybe someone you know is experiencing difficulties with their mental health and potentially could use some support is some of those signs can include feeling down, feeling depressed, lonely, maybe even hopeless. Also feeling anxious, worried, scared, possibly avoiding things that you typically would approach, but find yourself kind of not wanting to do those sort of things. Changes in your sleep or appetite. It could become more or less, just different from what you're typically used to. Experiencing severe irritability or mood swings that are not typical for you. Feeling numb, or maybe like even just feeling like going through the motions, like nothing really matters. Feeling confused, forgetful, or even just disconnected from those around you or things around you. Other signs are just using alcohol or drugs more than usual. Difficulty even performing your daily tasks, like taking care of yourself, taking care of your home, your children, potentially even having a hard time getting to work or school. If you notice problems in your relationships, conflicts, things that are coming up, those can also be signs of areas to kind of address mental health. And also having thoughts of hurting yourself or hurting someone else. These are all signs that something maybe is going on. So what are some things that you personally could do to take care of your mental health? there are a few things that are important aspects of our mental health. One of those is self-awareness. And really what that means is getting to know yourself and your triggers. It's really being familiar with your own beliefs, your own ideas, your own emotions, your own feelings. It serve as your own like personal barometer so that you know where you typically stand, so you can see when something feels off or maybe you even feel triggered. And when I use the word triggered, really that is something that affects, something that happens or occurs that affects your emotional state, making you feel really overwhelmed or distressed. Another aspect of taking care of yourself is self-care, attending to your own physical, mental health, and spiritual needs. Self-care encompasses all the different ways that we intentionally take care of ourselves in those areas to reduce stress and promote wellness. And that can look really different for everybody. But some examples are, daily physical activity, walking, yoga, even more strenuous exercises if you prefer, help create chemicals in our body and our brain that help calm us down, produce feelings that help us feel better. Other kind of self-care is eating habits, knowing yourself and knowing what nourishes your body, getting sufficient sleep, making sure that you wind down and give yourself the appropriate time to rest and reboot, recharging your own battery. And that could be like winding down and relaxing. But for some people that might be connecting and socializing, whatever it is that kind of helps you feel recharged, re-energized, and remotivated, and engaging in those enjoyable activities. All of these things help create chemicals and neurons and things in our body and our brain that help us feel better and help us better manage stress. Another aspect of things that you could do for your mental health is about values, living life consistent with your values and what's important to you. Just seeking and creating meaning in your life by engaging in activities that are aligned with those things that are important to you, and contributing to things around you. And that may be helping others, helping a neighbor, volunteering your time, your talents. Also using healthy coping skills. And so that's really knowing what some healthy coping skills are and being able to really use them when you're not stressed, but also when you are stressed. Some of those are breathing techniques, right? Being able to regulate your physiology by breathing. A lot of times we don't even notice this, but we might be holding our breath or breathing really quickly. And this sends messages to our brain that maybe we're in danger or we're overwhelmed. And so being able to regulate our breathing helps send that message that we're calm and we're okay. Mindfulness exercises. Mindfulness is being present in the moment. And so there are different exercises that can help with that. One being, we talk about using our 5 senses, kind of engaging and looking around you. So when you're walking around, being able to look at something, smell something, touch something, taste something, experience it, and using your 5 senses to help you really be in the present moment. Some other kind of things that are important is social support. Something that we talk about is the importance of creating a solid, positive support system. And that can be through family, friends, coworkers, community members, church. Sometimes we have those sources of support and sometimes it can be a little bit more challenging, or maybe it's about seeking that out or looking for that or being intentional about how to create that. And sometimes that might mean allowing ourselves to be vulnerable and really opening up, telling somebody what we're going through and being able to ask for help. And I think just remembering our humanity, that we are all human, we all have difficult times, and it's okay to talk about these things and ask for those things. Many people, if not all people, will be able to relate. So really reaching out and expanding and creating our social support. Also healthy boundaries, like setting and maintaining healthy boundaries with others. That can take many different forms. It looks really different, can depend on situations, right? At work, we might have one set of boundaries. At home, it may be another. But just being really mindful of like knowing what you value, what you're willing to accept, what is not okay with you, communicating those with others so that they're aware, being able to say yes sometimes and no other times, and valuing your own opinion and being your own advocate. Setting those healthy boundaries are really important for our mental health. These are all things that we can kind of do on our own. Sometimes they can be hard to do on our own, and we need an outside perspective or outside support to help us really strengthen those different areas. And if that is the case, very normal, very common, and there is help and support. And it's always important for all of us to be willing to go inward, to learn a little bit about ourselves and willing to grow. And so there's always help. So mental health problems are common. We've seen an increase during the pandemic. We also know that they're also common in smaller rural communities where at times we may feel disconnected, or there's times where we're maybe not connecting in the same way. And so, but there is help and there is support. And so if you notice any concerns for yourself or for others, please speak with a professional as well. Some professionals to consider is talking to your primary care doctor, someone you already have a relationship with that you trust, and letting them know how you're doing. They have resources and support and things that they can do to help as well too. And they may be able to refer you to a therapist or a counselor. You know, you might hear those words kind of used interchangeably in the community. The work is very similar. They're there to help. It's a form of talk therapy. It helps you gain better insight into what maybe you're going through and learning healthy ways to manage and cope. That could be a psychologist, a social worker, a counselor. So there's many different titles, but very similar work. There's also psychiatrists. Those are medical providers who specialize in psychotropic medications to help with the chemical balance that may be contributing to some mental health concerns. And so they're known for prescribing medications to help with that. Obviously, some do also provide psychotherapy and other sources of support as well too. But just for the sake of differentiating the different types of support, a psychiatrist is typically someone who specializes and helps with managing medications. There's also group supports that are oftentimes led either by professionals or peers. And I think those can be really helpful for connecting with others who are going through similar experiences. It reminds us we're not alone. And especially in areas where it's harder to get together, there's a lot of virtual ways to connect with groups. There's a lot of ways to Google and search for support groups. There's a lot that are free and out there and can be very, very helpful source of support. There's also hotlines. We have hotlines and soft lines. Hotlines tend to be more for in the moment crisis and needing immediate support. And I'll provide some information about that. And warm lines tend to be reaching out to just have some ongoing support or conversations. Two really important ones that I personally like, we have what's called the National Suicide Prevention Lifeline. And it's a resource for individuals who are going through emotional distress or suicidal crisis. It does not have to be for just suicidal crisis. It could be if you are just feeling overwhelmed, feeling like you're in some sort of emotional crisis or needing immediate assistance. They provide crisis counseling with, they're all professionals, and they provide you with that immediate counseling and can also help you connect to resources in your community. So it is a national number. And when you call that number, it reroutes you and connects you to a support in your local area. I'm going to share that number. It's 1-800-273-8255. Again, it's 1-800-273-8255. It's 24/7 confidential support that's out there. There's also, during the pandemic, California has also created another source. It's called Cal Hope, and it's a warm line. And so it's a peer counselor who you get connected with, who's persevered through struggles such as stress, anxiety, depression, or other emotions kind of triggered through the pandemic. And so it is more specific to that, but it's also used very generally. And they too can help you with just providing you with some support and some hope and some encouragement, and also connecting you with additional resources. That too is free and confidential. And that number is 1-833-317-HOPE. Again, it's 1-833-317-HOPE. And I'll go ahead and share that information too with the organizer so that can be passed on if you didn't have an opportunity to write it down. So thank you for having me, and I'll look forward to answering any questions at the end.
Thank you very much, Dr. Andy. That was a lot of good information in there. Thank you. So our next speaker is Dr. Laura Getz from the Borrego Springs Medical Clinic.
Okay, and I will start to share my screen here. All right, can everybody see that?
Yes.
Great. So I am going to talk about what I call, it is having a mind of its own. There we go. Disease prevention basics, or prevention 101. And when you think of the old adage, prevention is an ounce of prevention is worth a pound of cure. I think for people here in Borrego, I would say an ounce of prevention is worth more like 100 pounds of cure, for obvious reasons, and we'll go through some of them. But some of this is just basic prevention techniques, but I think it's worth mentioning so that we can kind of keep them in the forefront of our mind as we try to think about how to keep healthy, stay healthy, and prevent some of these chronic illnesses. So I think there are three groups that are responsible for maintaining health and preventing disease in any community. There are individuals, obviously, there are primary care providers and other providers, and there are communities. So I'd like to talk about the responsibilities for each of these three groups. If you think about individuals, there's a rule that I like to talk about. It's called the 3-4-50 rule. And if you haven't heard of this, this rule says that there are three behaviors: tobacco use, a poor diet, and sedentary lifestyle, that contribute to 4 disease conditions: cancer, cardiovascular disease, chronic lower respiratory disease, or COPD, and emphysema, or asthma, and diabetes. And those 4 conditions cause actually over 50% of deaths and many premature deaths. And I'm just going to repeat that because I think this is really important to think about. 3 behaviors: no physical activity, poor diet, and tobacco use, lead to 4 disease categories: cancer, heart disease, and stroke, type 2 diabetes, and lung disease. And those 4 disease categories lead to more than 50% of deaths, and not just in San Diego, in the whole country, actually. So if you think about how you can prevent those deaths and keep healthy, it's addressing those behaviors. So if we think about smoking, first, there are a lot of different ways to quit smoking. A lot of people have tried different things, and it's always a very difficult thing to do when you've been a smoker for a long time. I think one of the things that does seem to be effective for many people is the free helpline, the 1-800-NO-BUTS. Their motto is pretty good: the more you try, the more you succeed. So certainly smoking is something that you do have to try to really kick the habit in many different ways. And there are things that your primary care provider can talk to you about in terms of stopping smoking. But smoking is the #1 thing that will help you stay healthy and live longer if you do smoke. So quitting smoking is the primary thing that you should focus on. In terms of diet, I think everybody knows what they should do. It's just harder to actually do that. And there's a kind of a good rule of thumb in terms of this healthy eating plate, and that's making sure that your plate has at least half fruits and vegetables, and then half whole grains and healthy protein. And any fats that you're going to be adding are going to be the healthy oils, olive oil, canola oil, and things like that. And then in terms of beverages, you really want to avoid all the sugary beverages, obviously. Drink water and tea or coffee. And there actually is some data now that sometimes, people had said that milk is not really great, but there are situations where you might be able to add milk in safely. And then for the healthy proteins, of course, we want to focus on fish, poultry, beans, and nuts. So again, this is not really news to anybody in terms of what we know how to eat. It's just a matter of motivating ourselves to do that. And there are certainly some things that we can think about that I'll get to in the community section that make it a little bit difficult to kind of focus on this here in the Borrego community. I also want to talk about 2 tips. I think, in terms of fad diets, there are a lot of different ways that people try to, eat healthy and lose weight. But if you think about just 2 basic healthy eating tips, one is this idea that you want to restrict your calories. So with caloric restriction, you actually want to stop eating when you're about 80% full. And people say, well, how do I know what 80% full is? That's kind of an odd number, but I just tell people to think before you start eating that you're actually not going to eat until you're full. So if you kind of think about, I'm going to eat just as much as I feel like I need to, but not until I have that full feeling. So you kind of have to prepare yourself not to have that second helping. So stop eating before you're full. And then the second thing is, it's very important now, we've learned a lot about either people call it time restricted feeding or intermittent fasting, but it's very important to give your liver a rest, give your whole body a rest for at least that 12-hour period overnight. And doing that can actually help decrease the amount of inflammation that's in your body. As I said, it really helps your liver rest. And this has been really helpful in people who have high blood sugar, diabetes, hypertension, all kinds of things. So giving yourself at least a 12-hour window without any food in your body overnight has been really effective at maintaining health. The last thing is the exercise portion. So I think we all know that we need to exercise, and certainly there's a lot of opportunity to exercise here in Borrego during the winter season, but it's much more difficult when it's summer. So that's one of the situations that we really have to be creative during the summer months in terms of getting the exercise that you need. And the American College of Sports Medicine, ACSM, and the CDC, as well as the American College of Cardiology and other organizations, recommend 150 minutes, that's 2.5 hours, of moderate intensity aerobic exercise every week. So 2.5 hours. Think about other things that you might be doing for 2.5 hours, even a day that might not be so healthy for you. So I think we can all find 2.5 hours a week in which we're doing some exercise. And the moderate intensity part, if you're not somebody who uses heartbeat monitors and things like that, you want to feel like you're sweating a little bit. And again, not because it's 120 degrees out. You want to feel like you're sweating a little bit because you're working a little bit harder to exercise, and certainly doing it within any restrictions that you have with other health problems. But just getting that amount of exercise a week will help keep your body healthy. And we also recommend doing at least 2 days a week where you're doing some kind of muscle strengthening, be it little weightlifting or actually yoga or stretching, things like that. And the thing I want to stress about each of these 3 recommendations, the quitting smoking, the healthy diet, and the exercise, is that they all have the common denominator of actually boosting your immune system. So all of these decrease inflammation and boost your immune system. And your immune system is the first line of defense against all diseases, not just infectious diseases. We know now it's very important in preventing cancer and helping prevent heart disease. So all of these relate to boosting your immune system. Now, if we talk about what primary care providers need to do, this is a pretty harsh statistic. It came out in a study a few years ago. Only 8% of US adults over 35 years old currently receive all preventive care measures. And a lot of that responsibility falls on providers. And if you look at the graph between men and women in terms of who does better, well, you would think that there might be a gender difference, but actually it's pretty equal. Some age groups, women do better, some age groups, men do better, but overall, they only get an average of 8% of adults get all preventive measures. So what are those preventive measures that we recommend? And some of these are obviously familiar. We screen for blood pressure, cholesterol, we screen for cancers, breast cancer, cervical cancer for women, prostate for men, and colon cancer for both men and women. And then we screen for osteoporosis in women primarily. And then we also screen for tobacco use, and we counsel for tobacco use, as I just mentioned, obesity, alcohol use, depression. We want people to get vaccinated, obviously. And then preventive medication, this has actually changed. So now, of course, we're not recommending aspirin use for general preventive measures in average risk people. It's only if you have a history of heart disease or a stroke. And I think it's important, myself being a primary care physician, I'm the first to admit it's very difficult sometimes to keep up on everybody's preventive services. So I really strongly recommend that you be your own best advocate in terms of reminding your physician to check and make sure you're up to date on all your preventive services. So we really need to do a better job of increasing that number of 8% of the population getting screened to 100%, but we have a long way to go. Now, when I think about communities and what communities can do, I think this is something that is very important here in the Borrego region for a number of reasons, and we'll talk about it. But I think it's not just the local community. We have to think about the responsibilities of the county. So we have the County of San Diego, obviously, that has a lot of the jurisdiction over Borrego, but there are people who, you know, we have people going to Riverside for their healthcare and also to Imperial County. So there's a kind of a broader community that really impacts the health of everybody living here in Borrego. And if we just think of those three categories again, you know, the ones that are the most important in preventing disease, these are some things I'll just go over briefly to talk about what I think could help in the community level to improve the disease prevention and maintain health. I think we need programs to help people recognize and make healthy food and beverage choices. And a lot of that is going to be increasing access to healthy and affordable food. And certainly there are things that are going to limit that in Borrego. It's much harder to get healthy food here. It's harder to keep it on the shelves. So I think there are definitely policy things that can happen to increase healthy food and increase access. So implementing organizational and programmatic nutrition standards would help. And then even assuring food safety. And again, this is a huge issue in the summer months, but food safety and nutritional quality of the food supply is very important for us here in Borrego. In terms of physical activity, again, this is something that's very difficult during some of the summer months, but also because there are limited situations, even before the pandemic, limited gyms and things that you can, where you can go access affordable gym equipment and things like that. But I think the community can be responsible for assessing what the physical activity levels are across the board and provide education and counseling, as I said. And then even supporting workplace policies so that, you know, a lot of places where there's sedentary work, you can actually help increase the physical activity on the job. And then again, as I mentioned about finding gyms and things like that, making sure you're getting exercise in a safe place, you're not getting over stressed and getting dehydrated and heat stroke and things like that is important to keep track of that. And then just some other things in terms of getting the community on board to design physical activity programs, and then thinking about physical activity in our schools. And then in terms of tobacco use, I think we could do more to support some comprehensive tobacco-free and evidence-based tobacco control policies in the county, and also expand the use of tobacco cessation services. So things like 1-800-NO-BUTTS are great, but we need more than that. And then using the media to educate and encourage people to live a tobacco-free life. And what I'm interested in doing too, as part of my work here, is looking at programs that can be implemented, as I said, kind of throughout the community, but getting grants. So there are a lot of grants that are available from different organizations that are specifically stressing preventive programs. So I think there's a great opportunity to start putting these programs together and getting funding to actually help institute things across the board. And again, I'll just reiterate that, you know, there are these three groups that are responsible, and we all need to work together, because individually we can't do it alone. We need the help of our primary care providers. We need the help of our communities to really impact this chronic conditions and decrease the rate of death from these conditions. And I'll just end with a quote that maybe some people have heard of, but this is kind of a great illustration of how I feel about preventive medicine. And it says, if people are constantly falling off a cliff, you could place ambulances under the cliff, or you could build a fence on top of the cliff. And I think right now we are placing all too many ambulances under the cliff. So I would love to work together with people in the community to start building more of those fences. And with that, I will stop.
Okay, thank you very much, Dr. Getz. That was really an excellent presentation. We have a couple questions came in as well, and we will take those at the end. So finally, we have Dr. Silas Jimmy.
Hi, everybody. This is Dr. Jima. Hope you can see me.
Well, we see your...
Okay, sounds good. So, essentially, I'm going to be talking about skin cancers at this point. And nice presentation so far, and I'm just going to add to that. So let's see. Okay, so you see everything. So the objective today, basically, we want to talk about squamous cell cancers, basal cell cancers, melanomas, actinic keratosis, and other inflammatory skin lesions that we tend to see in our practice. And also being in this area, the incidence of these pathologies are very significant. So it's worth shedding some light on. So the three big ones I want to talk about, based once again, squamous cell, basal cell, melanoma, and some of these other things. And the time anatomy wise, just looking at this, gives you a pretty good idea as to the different layers in the skin and the type of involvement that these pathologies affect, hence the type of treatment and management that we pursue clinically. So squamous cell carcinoma, in the United States affects approximately about 4,000 people. There was about 400,000 people, so about 3,000 deaths per year. Risk factors are essentially associated with, extensive UV light exposures. We do see some of these pathologies in the advanced age, living near to the equator. In other words, California, that's where we are. And also, specifically in the valley, in the desert here, that is exactly the part of the, so to speak, the globe that we reside. So the cases in this area are very significant. So these lesions right here, this is basically cutaneous squamous cell carcinoma. You see this presentation on the skin. This is something that should cause a little bit of alarm for you. To follow up with your primary care provider for further evaluation. Typically, the presentation would be non-healing skin lesion that basically may end up bleeding without any significant trauma. We tend to see these pathologies on the head, basically the sun-exposed areas. So the head, the neck area, the upper back, we tend to see some of these pathologies as well. Obviously, relatively light-skinned individuals have increased risk for these pathologies. So what we do is, when we see you in the clinic, we do a thorough physical exam just to make sure that we are not missing anything. If we are concerned of this being a cancerous lesion, we would do, in some clinics, I do actually have a procedure clinic here. There's a hot springs where I do procedures on Thursdays, and I do quite a bit of these, shave excisional biopsies. I send them to pathology. That gives us more information to figure out. So these are the three different things. So basically, shave biopsy is as shown here: punch biopsy, excisional biopsy, and we use this dermoscope as a way to give us more information on some of these skin pathologies. Clinically, there are specific things we are looking for with this device to give us an inclination. Is this a cancerous pathology? Is this not a cancerous pathology? So we can give better reassurance to our patients. So these are some examples of squamous cell carcinoma. This may just appear to be some sort of skin infection around the nail, but depending on how long it has been there, assuming more than 6 months, even more than 3 months with a pathology like this, after taking antibiotics, because most clinicians may be seeing this, was assumed is just a skin infection, and hence give you some antibiotics. You try them, doesn't work, and it's still ongoing. It's highly suspicious for squamous cell carcinoma, and you need a further evaluation. It's another cutaneous squamous cell pathology that you may see. And these are just examples I just wanted to share with you. We also have these pathologies in the mouth as well. You can see this right here where my cursor is. Actually, where my cursor is, once again, these pathologies depend on the duration and just the morphology, how it appears. We are trained as clinicians to be able to identify some of these things and be able to get on top of them right away. Management wise, we do an excisional biopsy. Once again, you can surgically remove it. We do a Mohs surgery, it can be done. We typically will refer to the dermatology to perform these procedures. And in some cases, we perform radiation therapy. Those who are not good candidates for surgical intervention. Now, how can we prevent this from happening? Essentially, sunscreen, right? So the sunscreen protection factor, SPF. If you buy your sunscreens, typically on the bottle it'll show you the SPF number. And I just wanted to put these numbers out here for you to know the level of protection you are getting. So 15 to 30 shows here 93 to 78% of UV protection. So that's the squamous cell carcinoma. The other common pathology we do see with skin disorders like this are essentially basal cell carcinoma. Once again, most common among our Caucasian populations, lifetime risk of occurrence are roughly about 30%. As we are aging, there is significant risk for this. More extensive radiation exposure to the sunlight obviously increases our risk. UV radiation, once again, sunlight is the most important one that increase most people's risk of developing this type of pathology. Once again, about 70% of the time, it affects the face. That's primarily because of the direct sun exposure to the face. And about 15% of the time, it can go onto the trunk, which is upper back, upper chest area. We can see some of these pathology. It could be on your arms as well. We do exactly the same thing with a dermoscope. Make sure we fully visualize the pathology. Make sure it's not a malignant pathology or it's a benign pathology. Then from there, we do the needed steps, such as once again, shave biopsy, excisional biopsy. We'll refer to a dermatologist if needed for further evaluation. And prevention is once again sun protection. These are some typical examples of basal cell carcinoma. They have different groups. So this is a nodular type of basal cell carcinoma. This is on the nose. This is actually also on the temple. I just kind of cut a picture so you can see the whole thing. But basically on the upper side of your face in this area, and this is on the nose. We do also have the superficial one, which is also relatively common. These will be a typical pathology, hypopigmented skin lesion here that appears with the scaly appearances. And we have also the infiltrative pathology as shown here. Now, these are, I would say, big medical terms. You don't need to worry yourself about that. I just wanted to show you the pictures so we can get you some insight. And melanoma, this is the most serious of all the skin cancers we tend to see. The fifth most common cause of cancer in men and women in the United States. And obviously the incidence increases as we age. And we do have different subtypes of it, and I'm going to show it here. We have the superficial spread, we have the nodular type, and we have the lenticular type. But once again, don't worry so much about the terms, but it's just a presentation I just wanted to highlight here. On face value, some of these presentations may appear to be like a simple mole, but it may not necessarily be the case. We look at the morphology of it. So the size, we're looking at the size, we're looking at the borders, we're looking at the different variations in color of these lesions. And that's what gives us a clue as to what is actually happening here. How we diagnose it, how we manage it, is exactly as stated before. A thorough physical exam we do perform on our patients, and a biopsy to identify exactly what is what type of skin cancer or skin lesion that is. and we pursue treatment after that. Now, this is one I just wanted to highlight. It's called like keratosis, relatively common. Almost most of my patients do have this. And it feels like a sandpaper type of skin lesion on the forehead, on the scalp. And it could be on any part of the face, the neck, but typically on the forehead, the scalp, the forehead. And you feel like a little sandpaper presentation, and most people tend to pick at it. It bleeds a little, it goes away and comes back. These are typically benign, but although they do have the propensity to transition into becoming actually more concerning cancerous lesions. And we typically would do a cryotherapy for this for management with liquid nitrogen. These are other inflammatory skin disorders I just wanted to highlight. That is not cancerous, but it may appear to be. And this is basically showing this, plaque-like formation, which is usually around the knee area, at the elbow. You can find similar presentation there. That's usually a psoriasis type of rash. It is non-cancerous. Obviously, it's an autoimmune disorder, and we will manage it appropriately. Also, this is what we call a Cyborg Keratosis. It's basically medically, it's a Stockholm lesion. It's a very dark lesion. It feels like something has been kind of stuck on the skin. And typically, the distribution is most of the cases I have seen usually on the back. That is non-cancerous. It doesn't really follow the description that we tend to see like in melanoma, which is more sort of a flat type of skin lesion. So we don't really get overly concerned about that. It is non-concerning actually. And this is just eczema. Eczema is essentially dry, patchy skin, which could be anywhere inside your elbows, behind your knees. It could be at the base of your neck. It can be any part of your body as well. But typically, it's very dry and patchy. And we treat those with steroids. This is other pathologies that are more so really nothing to worry about as cancer is concerned. These are basically inflammatory issues with also other immune issues, but non-cancerous. So you may see some of these things and you may start panicking, but there is no need to. These are non-cancerous lesions. And these are my references. Any questions?
Okay, thank you very much. I think Dr. Jima wins in the category of cringy medical pictures. You've taken first place. I think if I had any of those things, I'd probably be heading to the doctor's office pretty darn quick. Okay, so now we can look at questions. And fortunately, these are all arranged in the order that you spoke. And I can go through those. So Dr. Thomas, is asthma related to allergies, or is it completely separate disease?
Yeah, so that's a really good question. So asthma is its own disease, but interestingly enough, there has been a well-documented connection between asthma and two other conditions. It's actually called the atopic triad. So those three conditions are asthma, allergic rhinitis, which is what we talked about earlier, hay fever, which is the sneezing, runny nose, and also atopic dermatitis, or more commonly known as eczema. And it seems like there's a common trigger between the three of them, especially when you think about children. Some studies have shown that children who have, for example, one or two of the conditions may have like a lesser form of the other condition. And studies have shown also for asthma in particular, these people tend to have higher IgE levels, which is the antibodies that we spoke about during the presentation. And we know with IgE, those are also related to allergy symptoms, essentially. So while it is its own separate disease, there is a connection. There's a genetic predisposition. It's interconnected, but not everyone, like I said, who has asthma will have allergies or will have eczema, but it is something that's been pretty well documented.
Okay, I have another question here that says, People come to the desert to get away from their allergies. What do you have to say about that? Is the desert worse or better in general than other places?
Yeah, so I think with just allergies in general, I think it does depend on the time for sure, like the seasons that you're going. But with each different environment, there's different types of allergies. So while you may, for example, you may go somewhere where it's more humid and there's more maybe like pollen from the trees. In the desert, you're thinking about completely different allergies, like pollen, for example, or even mold particularly. So it really depends on the person too. Like every person's body is different. So that's something to consider.
Okay. Okay, I guess that's it. So, okay, Dr. Gandhi, let me see what we got here. Okay, I've called PERT for a friend in town and even spoke with the sheriff, but I've not received a call back. What can I do? This friend is slowly losing it mentally.
Sure, that's a really great question. And I think a lot of us, may be concerned about ourselves or others. The PERT is a really great resource. The PERT stands for Psychiatric Emergency Response Team, and it's a part of the police's efforts to have somebody who is a mental health professional come to the home to check on individuals that we maybe are concerned about. And so they come in typically not dressed in law enforcement and are able to, but come with law enforcement to be able to check on individuals. So I think it's great that you did use that resource and called. Sometimes it can be helpful to follow up with the sheriff's department or your local department just to let them know that you are curious about kind of the outcome. And so typically calling back to ask, depending on confidentiality or other reasons, they may or may not be able to share that information. But that is one way you could reach back out, is to the local law enforcement to ask for an update. But again, that's a very great resource. Also, maybe sharing that in the accessing crisis line information with your friend could be also potentially a resource for them to be able to reach out when they are having some difficulties, to have some immediate help or support. Or if you yourself are concerned and curious about other resources or potential services in your area, you can also call the Accessing Crisis line as well too, and explain the situation and ask for additional resources that maybe would be more specific to your friend or loved one.
Okay, and one other question I have here that's actually very similar to the first one there. Friends and family are going to notice mental health issues more than the individual. What could you say to these family or friends in regards to trying to get that person to seek help?
Yeah, absolutely. I think sometimes we have some insight into knowing what we are going through, but oftentimes, denial or just even uncertainty, and it can be hard to see our own stuff. And so oftentimes loved ones are a really good resource for just highlighting changes or concerns. And I think coming to your friends, family, loved ones from a space of really caring and loving kind of space is really, really important. And just starting with, hey, these are some things that I've noticed. These are some concerns I have. What do you think? Are you okay? I'm here to talk. I'm here to listen. I'm here for you. Everyone might be in a different journey with their mental health. There is stigma around mental health. We come from families and cultures where maybe this wasn't talked about, or we don't see it as a mental health concern. We see it as just, this is just how I've always been, or this is how it's been. And so I think starting the conversation is what's really important, and coming from a loving, caring space so that that person can see your love and your concern will begin to hopefully build some trust so that they can begin to share with you what's going on. So I think just starting with, this is what I've noticed. I'm concerned. I'm here for you anytime you want to talk. And maybe even if you are very concerned, offering other resources and saying, here's some professional help. If you're not comfortable sharing with me, I get that. Talk to your doctor. And even being curious, just coming from a space of curiosity. Do you have somebody you can talk to? Just to get them to begin thinking and seeing that maybe there is something going on, and leaving them with some hope and some support that you're there for them, but there's also professional help. And I think a big part too is sometimes sharing our own story. Sometimes just saying, hey, I've had some struggles too. I've, had some times where I felt really down, or I felt really anxious, if those are true for you, right? And I think all of us as human beings can relate to that. And speaking to if you've ever received help and support and what that's been like, to really normalize, to really help people understand this is normal. We all go through it. We all experience some form of sadness, depression, grief, anxiety. So it's not a matter of if you have it, it's just a matter of when you're experiencing it. And as a community, we're definitely here to love one another, support one another, and connect one another to help and resources. So just really starting the conversation is important.
Okay, thank you very much. Okay, so let's see. Dr. Getz. Okay, so I have two comments actually. The first one is, Dr. Getz, how can we get the Borrego Farmers Market to accept food stamps as our most vulnerable population needs fresh produce?
That's a great question, and I would love to help explore that. I don't know off the top of my head who to approach for that, but I think this is one of the things that's near and dear to my heart, is getting access to fresh produce that's affordable. So I'd be happy to explore that with people and see what we can do.
Okay, and one other comment I have here, it says the 3, 4, 50 diagram was especially interesting. I've never seen that before.
Oh, great. Thank you.
Okay, so now we go to Dr. Jima. Let's see what we got. Okay, if you use sunscreen all the time, how much sunlight is safe for vitamin D absorption, which is necessary for health?
So actually, sunscreen does not decrease the level of vitamin D production. We know the primary source of vitamin D is actually from sun exposure. So using sunscreen does not decrease that amount. The recommendation is maybe do 20 to 30 minutes of sun exposure a day to kind of help bring your vitamin D up. You can go outside, get that sun exposure using your sunscreen to prevent you from the potential skin cancer issues. And vitamin D has enormous amount of benefits, so it is highly important that you pursue that. That should not prevent you from being worried about skin cancer, should not prevent you from getting some exposure if you use sunscreen.
Okay, how prevalent is skin cancer in our area?
It is. So really, like I said earlier, the location that we are, I can't give you any specific numbers, but the location that we are certainly increases our risk factors among, like I said, fair-skinned individuals. So I do see quite a bit of, and I've identified quite a bit of pathologies in my clinic, even here in Desert Hot Springs. I can only imagine Borrego Springs, which is, as far as the weather-wise, essentially all the same anyway. So it is significant by virtue of area and by virtue of basically ethnicity.
Okay, let's see. Okay, so I have a couple other questions here that really aren't directed at anyone. One says, what's the situation here with valley fever? Is it common here in Borrego? Can you get it working outside and digging in the dirt? Who would like to take that?
Oh, I can comment on that. Valley fever, it's not common here in our area, but in California, the significantly predominant areas are places like maybe somebody can help me there. Bakersfield. Bakersfield. Yes. Yes, Bakersfield. That's where we tend to see that. Rarely do we see it in the valley here.
Okay. And this one looks like it's for Dr. Getz. Is some of the obesity in the US related to poor quality agribusiness rather than just eating habits? Did you get
Poor quality agribusiness, just in terms of the overproduction of food that's not nutritious, or just how?
Well, I'm not sure, but maybe like genetically modified food,
Oh,
stuff like that.
right. Or I think a lot of the antibiotic usage in
Yeah.
livestock, certainly that does have a lot to do with obesity, and there are a lot of there are what we call endocrine disruptors that people think are due to some of the pesticide usage and things like that that can contribute to obesity. So there's a definite component, yes, for sure. So it's not all just eating habits, and the public health kind of pandemic of obesity, the approach has a lot of different philosophies in terms of how to address it, and it's not just eating. You're right. So there's a lot more to do with this pandemic of obesity than we think of as just bad food. So good point.
Okay. Well, that brings us pretty much to the close. I wanted to say something about what we have next week. We have a program next week, same day, same time, called Healthcare in a Remote and Rural Community. How is healthcare addressed here? This is a program that will share information about the healthcare in Borrego Springs, from primary care all the way to emergency transportation. And we'll have healthcare professionals from Borrego Health, the Borrego Springs Medical Clinic, the fire department, and also Mercy Air. And the third and the final part of our program is really going to be a lot of fun. We hope that a lot of families come out with their kids. So on Saturday, the 22nd, from 10 till noon, we're going to have a helicopter by Mercy Air and an ambulance by the Borrego Springs Fire Department on Avenida Noreste, which is right across from the circle. And there'll be the people there who staff those. You'll be able to talk to them. They tell me kids will be able to go inside and have a close-up look. So that sounds like a lot of fun. And people who are looking to take their kids somewhere and also learn about emergency transportation, this will be a great time to do that. So with that, our program tonight comes to a close. I want to again thank our presenters for taking the time out of their personal evening tonight to be with us. It's very much appreciated. And we'll say goodbye. Goodbye.